Morning, Mrs. Heltzel.
Morning. You can put your things in the kitchen.
Caring for individuals at end of life, especially in home, allows healthcare providers to become close with patients. Over the course of time, patients might see you as a supportive person to talk to. This connection may prompt patients to describe or acknowledge their past traumatic events. For some, this might be the first time they ever shared their story with another person.
Well, if you have medication you no longer use or are expired, I can help you dispose of those through a drug take-back program. Or I can help you do that here at home.
At home?
Great. Let me clean up and we'll walk through those steps.
I had no idea I could throw away medications at home.
Yeah, almost all medicines can be thrown into your household trash. You just have to mix it with something undesirable, like coffee grounds, cat litter.
How far along are you?
20 weeks.
Boy or girl?
We want it to be a surprise. Do you have any kids?
No. My first husband wanted to, but I was always nervous about it. He had 6 with his second wife.
6? I think I'll stop at 2.
Can't blame you. I may have been exposed to Agent Orange. That's why I was nervous. Soldiers would come in with their fatigues coated in it. I can't tell you how many of those uniforms we cut away. I had a friend, a nurse I'd worked with. She had a baby with a birth defect. Now, I don't know if that had anything to do with it or not, but I wasn't going to take that chance. There's so much I wish I could have left there, but you can't.
People often think of combat veterans as the only ones having traumatic experiences, but it can happen to nurses too. Is there anything about your military experience you'd like to tell me about?
You couldn't wear makeup because it was so hot. A little bit of lipstick, maybe, that was it. Soldiers, all they wanted was comfort, someone to remind them of their mother or a sister, a girlfriend. One morning, before my shift, I couldn't get rid of the stench of death from the night before. I didn't know if it was in my head or if it was really there, but I couldn't go in like that. I had a bottle of perfume from R&R. I put some on and went to work. That night was a revolving door. It just kept coming in. We had to triage, decide first priority. We wrote vital signs on their chest with a magic marker. And all the time, they would just lay there watching you, watching your face, just watching to see what your reaction to their wound would be. There's one soldier, been out on patrol, stepped on a mine. He knew he stepped on it, so he warned everyone around him. They all scattered, found cover. As soon as he saw they were safe, he jumped. Somehow, he was still alive and conscious when we got him. But the back of his legs, all the way to his waist, were really bad. The chopper medic kept pouring fluids into him. We did the same. But just as fast as we put it in, it came pouring out. The thing that haunts me, though, is in the midst of all this chaos and blood and yelling, that young man looked me right in the eyes and said, "Ma'am, you sure smell nice." Those were his last words. He died soon after. I always carried a bottle with me after that. I'd put some on as soon as I heard a chopper coming in.
What a beautiful way to remember him.
Healthcare providers can support patients by actively listening without judgments, expectations, or distractions. Respond genuinely and refrain from offering platitudes, advice, or statements that may inadvertently invalidate or minimize a patient's experience. Providers may acknowledge or thank the individual by saying, "Thank you for trusting me with this memory," or "Thank you for sharing your experience with me." Follow up by asking, "In what ways can I continue to help you?" Or, "I want to make sure you experience the healing that you need." In addition to the care you're receiving now, you can also speak with a mental health professional if you'd like. It's important to recognize one's own limits, especially for providers without advanced mental health training. Depending on your role, it is not the responsibility of a provider to become a patient's therapist.
Talking about your experiences can be difficult and also meaningful. And sometimes these memories can resurface when we least expect it. Is that what it's been like for you?
It's like a little black box where it's all been stuffed deep inside. It's always there. And I think if I were to open that box, I wouldn't last 2 minutes. So I keep it shut, lid closed. But every now and then, bits and pieces come out. It's difficult, but I think I'm okay with it.
That's an important step, Mrs. Hetzel, and I'm happy to talk with you about it again. But if you'd like to speak with a mental health provider in addition or instead of me, I can help you with that too.
I'd rather talk to you.
Okay. And along with talking about your experiences, I'd also like to hear about your current coping strategies for dealing with these stressful memories when they come up.
You want to do that now?
We can start that, yes. Or we can continue our discussion about disposing of medicine. It's your choice.
The medicine.
Perfect. I think we left off at cat litter.
I think so.
Well, you can mix medicine with something undesirable like cat litter.
Providing psychotherapy for persons with PTSD takes time and special training. For this reason, creating a list of trained therapists for patient referral will be helpful. The deep, personal nature of end-of-life care can foster trusting relationships between patients, families, and providers. If a patient discloses details of a traumatic event, remember, listening with empathy is a powerful gift any person can offer.